Hi, my name is Catherine Schwarzschild. I use she, her pronouns, and I'll be explaining what a day might look like for a member here of the NHC at Penn Medicine. I start my morning by saying goodbye to my roommate's cat Milo, and then I walk to work through Clark Park. One thing I greatly enjoy about walking to my host site is that I get to walk by a lot of historic buildings, which are often marked by these blue placards with gold text. Philly is also well known for its street art, which I get to enjoy on my commute. This is a view from the host site, Penn Medicine, and I'll get there early in the morning sometimes to pack up vaccines to put in the van. Today we're headed over to a high school to provide a vaccines for children's clinic, also known as a VFC clinic. After unloading the van, we get the paperwork and documentation table set up. We often have patients who speak languages other than English, so we make sure that we have enough languages available. Here are some of the supplies we use at vaccine clinics, and then we'll take the vaccine coolers back to Penn Medicine once we're done with the clinic. Not only have I had the opportunity to help with the administration of VFC clinics in schools, but I've also been able to help with the provision of other primary care services, such as A1C testing or blood pressure screenings in other community-based sites, for example, churches. In addition to clinic administration, I also help with healthcare case management for immigrants, asylees, and refugees, as well as marketing campaigns for the UCC, United Community Clinic, which is a free clinic here at Penn Medicine providing healthcare to underserved populations in the Philadelphia community, primarily in the Southwest and West regions. When I'm not at my host site, you might find me around Philly, either volunteering or socializing with my other cohort members. I've been very fortunate to make some really wonderful connections and friendships here, and it's also been an incredible educational experience being able to work in the public healthcare sector and seeing firsthand how these community-based clinics are able to address social determinants of health and increase health equity. I also wanted to highlight that this program is often an opportunity for people to immerse themselves in a new city and get experiences they wouldn't otherwise get. So here are some images of some places I've been around the Philly area when I haven't been participating in service. Lastly, I wanted to say that this program hasn't just been about professional development and gaining experience in the healthcare field, but it's also really been about gaining a newfound sense of self-efficacy. For me, I moved to a new city where I didn't know anyone. That really gave me a higher sense of self-confidence, being able to make new friends and contribute constructively to the community. So for anyone who's thinking about joining the NHC, it can be hard sometimes, but it's definitely a rewarding experience. So good luck, and I hope you enjoy your service term.